Hello friends, here I will show you the Wells criteria for DVT. So as you know that DVT and pulmonary embolism, especially pulmonary embolism in the pregnancy, DVT in the pregnancy, so at least 3 to 5 questions you will get in the exam. So these two topics you have to cover it. Here I will show you Wells criteria, which normally looks difficult to memorize, but as I have shown you here, it's very easy to remember. So the C3 PhD can lead to DVT. You have to remember C3 PhD can lead to DVT. So here C1 cancer active or within 6 months. Here you will give the 1 point, all are 1 point. So, and C2 is calf swelling more than 3 centimeter compared to other leg, and C3 collateral superficial veins which should be non-varicose. Keep in mind non-varicose collateral superficial veins. So C1, C2, C3. So this is C3, means 3 times starting with the C. C1 cancer, C2 calf swelling, C3 collateral superficial veins. Cancer, calf swelling, collateral superficial veins. So these all three comes with the C. Cancer, calf swelling, collateral superficial veins. Next is PhD. PhD. So very easy to remember, PhD. P for previous DVT, H for hospitalization or surgery in past 4 to 12 weeks, P for previous DVT, H for hospitalization or surgery in previous or past 4 to 12 weeks, and D for deep vein tenderness. D for deep vein tenderness. So D for deep vein tenderness. After PhD, can means can't move, bedridden, paralyzed, can lead leg swelling. Entire leg should involve leg swelling. Can lead DVT. DVT, no alternative diagnosis more likely. It's also +1. So can lead DVT, can't move, bedridden or paralyzed, lead leg swelling, DVT, no alternative diagnosis more likely. And last one is other diagnosis, alternative diagnosis more likely. If anything which shows that alternative diagnosis is more likely, you will reduce 2 points. So the 2 point will be deducted from remaining if whatever the positive points are coming. So now hope you understand C3 PhD can lead to DVT and other diagnosis, which is alternative diagnosis more likely, -2. So if the score is more than 2, then DVT is likely. If score is less than 2, then DVT is unlikely. So if DVT is likely, then you will go for further investigation. If it is unlikely, then you will think on other diagnosis. So I hope you will understand. Again, I'm going to repeat this. C3, cancer active or within 6 months. C2, calf swelling more than 3 centimeter compared to other leg. C3, collateral superficial veins that should be non-varicose. And with PhD, previous DVT, H for hospitalization or surgery in the past 4 to 12 weeks, D for deep vein tenderness, can't move, bedridden or paralyzed, lead, leg swelling, which should be entire leg, DVT, no alternative diagnosis more likely, which is also +1, and in last, other diagnosis, alternative diagnosis more likely. It should, if it is alternative diagnosis more likely, it means you will reduce 2 points. So if the total points are more than 2, then DVT is likely. If it is less than 2, then DVT is unlikely. I hope you will understand, you will memorize. It's easy to remember. This will help you in the exam. This will save your time. So I hope you will understand. Thank you very much.